Hi everyone, Dr. Suneel, Dhand, medical doctor. Welcome to another video. I want to introduce to you a series that I will be working on with the excellent Dr. John Campbell. Many of you may have already seen the teaser episode last week. And in this series, we will be exploring some natural methods, primarily with regards to food products, which have been shown in research to have great benefits for many common ailments out there. And of course, it is not culture in our modern day society to talk about these more natural methods to greatly improve our health and well-being. Now, I have been of the philosophy for a long time, way before I even started any of my social media channels, that I would rather take 10 natural food products or 10 natural supplements than I would one synthetic prescription pill. It is not my cup of tea to jump to a prescription medicine. I want to try to do everything possible naturally with all of the amazing compounds which are already around us in nature. And everything that myself and Dr. John Campbell are going to discuss is going to be based on evidence and research. But unfortunately, a lot of this research isn't really promoted by the mainstream media. We all know the mainstream media is pretty much owned by big business. Neither is it promoted by the medical industrial complex or by doctors who are entirely focused on their pills and their injections. It's a very sorry state of affairs. So here we go with this first episode. We are going to talk about flaxseed for the management of blood pressure. And as with any of these episodes, nothing here is direct medical advice. We are going to present all of the research to you, and then you make your own decisions whether you would like to give any of these a try according to your own tastes. Hopefully all that we are going to present to you will be compatible. You will be able to tolerate these things and give them a try if you want. So here we go, myself and Dr. John Campbell having our first great discussion on a natural medicine. Yes, absolutely. And to emphasize to our audience, we don't know what each other is going to talk about. So in this particular episode, John has something. I have no idea what he's going to discuss. I'm going to talk to him and gather evidence out of him. Next time we talk, it will be me. So I want you to understand we have no idea. And I was scratching my head this morning thinking, what is John going to talk about? But I genuinely don't know what he's going to talk about now. And I'm going to be somebody who is going to be getting this information as you are. And then I'll be teasing out more specifics because we're each curious about what we have to say.
What could possibly go wrong? Right. Should we go on to my presentation for today, Suneel?
Yes, I'm ready.
Right. Today, I haven't got a drum roll, but today I am going to be looking at the remarkably humble, inexpensive, ubiquitous, almost universally available flaxseed, also called linseed. Now this comes in two forms. This is the seed form. Now if you eat this, it'll just go straight through you. You won't get many nutrients out of it. So what we need to do is grind it, and we can buy the ground form, and this is the ground form here. And this is quite dry. If I took a mouthful of this now, I'd probably be spluttering. So what I do, Suneel, is I just mix in this with a bit of kefir or a bit of yogurt. Or if I'm making some porridge in the morning, I'll just put in a couple of tablespoonfuls, or you can put it in soup. And actually, now I've got used to it in my porridge, it kind of gives a bit of a crunch and a nutty feel to it, a nutty taste to it. So I actually find porridge without my flaxseed now really quite insipid. So I add this regularly. Now the amounts in these bowls here aren't arbitrary. There's 30 grams there, and there's 30 grams here, because in the study I want to tell you about today, 30 grams was sufficient to significantly reduce blood pressure without any blood pressure medications, and that's quite surprising. And what we're looking at today, this is published in Explore, and it's actually what you call a triple blind study, but it's a blind study, and it comes from Iran. Now, I find it a bit disappointing that a lot of what you might call independent-minded research that's not pharmaceutical related often doesn't come from the United States, often doesn't come from Canada, often doesn't come from Australia or the United Kingdom. Would you find that disappointing as well?
I've noticed exactly the same thing, John. When we're talking about these types of studies, I find a lot from Asia, the Far East, some from Africa, very few from Western countries, and this gets back to our whole paradigm here.
Yeah, I agree completely. Anyway, let's look at what it says. Obviously, as always, we'll put the links in. So, flaxseed or linseed. Now, this is under the heading of what you might call nutraceuticals. So, nutrients that have... It's kind of a mix, isn't it, between the word nutrient and pharmaceuticals. So nutraceuticals, compounds that can have, or foods that can have, an effect on the physiology of the body. Now, flaxseed provides protein, fibre. Critically, I think we're going to see omega-3 fats. So this is a good vegetable, plant source of omega-3 fatty acids. A good range of vitamin Bs, magnesium, copper, manganese as well, and it's relatively low in carbohydrates, which of course is often good with a lot of what we think about these days. And flaxseed's actually been implemented in reducing the risk of some cancers, maintaining a moderate weight, and reducing cholesterol and blood pressure. So there were some studies that seemed to show that blood pressure and body mass index could be reduced, but this has done it more specifically, which is what we're looking at. Now, I think it's worth mentioning that there's other foods that can lower blood pressure as well as flax seeds. So we think about fruits, for example, that contain a lot of K, the element potassium. These are known to help reduce blood pressure. Oily fish are because of the omega-3s. Leafy greens because they contain polyphenols, these highly nutrient antioxidant compounds in some foods. Nuts and seeds we know are good for blood pressure. Legumes, berries, olive oil, perhaps extra virgin olive oil, carrots, eggs, tomatoes, broccoli, yogurt, herbs and spices. What would you notice that those sort of foods have in common, Suneel? What do you think? All sort of natural products was my thinking.
Exactly, all natural. You get them in a certain place in the supermarket or grocery store in the US, found on the outside. In the UK, typically when I've been to Tesco or Sainsbury's, it's on the inside, so the other way round. But yeah, very pure foods right there.
And it looks like a food. It doesn't look like a packet or a tin.
Not an industrial concoction.
Yeah. Not made in a factory. Right, so this paper is called Effects of Flaxseed on Blood Pressure, Body Mass Index and Total Cholesterol. So it's actually looking at those three things in hypertensive patients. So these patients were referred to the Khor Ahmabad Medical Centre in Iran. And these were patients referred by their general practitioners or the equivalent to this specialised high blood pressure hypertensive clinic where physicians were working. And rather than putting these patients straight onto various pharmaceuticals and drugs like we would in the United States or the United Kingdom, the patients were given the option of going on a 12-week trial where they were going to be given 30 grams of flaxseed, 10 grams of flaxseed, or a placebo. And that's actually good design, of course, because the placebo looked and tasted like flax seeds because they got some clever herbalists and cooks to take wheat and prepare it as if it was flax seeds. So the patients genuinely didn't know what they were getting. Do you think placebo effects are important in medicine generally, Suneel?
Placebo effects are, absolutely very important. And it's crucial that any well-designed study also has a placebo arm. So for anyone who doesn't understand fully, placebo is when you basically get nothing at all, as opposed to any dose of any particular substance.
And of course, when we give our drugs anyway, when we give painkillers, if we say, well, this is a really effective painkiller, we can get a placebo effect on top of the pharmaceutical effect, which is always good to have. We'll have anything that helps our patients. So this study was conducted in patients that were already hypertensive to determine the effects of flaxseed supplement on the body mass index, the cholesterol, and particularly the blood pressure. So as we said, the trial went on for 12 weeks, and the patients, by the end of the study, there was about 45 patients in each group. They started with 45. So 45 were given 10 grams of flaxseed a day in addition to the normal diet. 45 patients were given 30 grams in addition to their normal diet. And about 45 again were given placebo. And they looked at these groups at the start of the study and they found out that they were comparable. And this is where randomization comes in. It very often gives us equal amounts of men and women age profiles in both groups. And they were satisfied with that, and they did check that with other statistics. So that was pretty good research technique, I felt, as I read through the study. Now, the results for the 30-gram group, the mean systolic blood pressure started off at 148, and over 12 weeks it went down. So basically these patients, Suneel, were being admitted to a hypertensive clinic with a blood pressure of 148, just over 148. Would that be, if that was consistent, would that be concerning?
Yeah, I mean, it wouldn't, I would say, raise an emergency red flag, but it's higher than we would like generally. Yeah, in the high 140s.
It'd be nice to get it down a bit, wouldn't it? Yeah.
Yeah.
Now, over 12 weeks, now this is completely unreasonable of me, but over 12 weeks of flaxseed, just take if you want to, or you can pass, of course, take a guess. What do you think the systolic blood, I'll give you a clue, the systolic blood pressure was reduced. In the placebo group, the average systolic blood pressure went up 1.72 millimeters of mercury. It went up in the placebo group, just a tiny bit. Not really significant, but it did go down quite a lot in the group getting the flaxseed. Do you want to guess how many millimeters of mercury it went down by?
Let's say 5 to 10.
That's a very reasonable guess, and I would have probably guessed at the lower end of that, because I must say I was surprised. The actual answer is 13.38.
Wow, that's a very significant amount.
It really is. And so the mean systolic blood pressure at the start was 148.38, and at the end of the 12 weeks it was 135.
Wow.
And they did the statistics on this, and they get what you call a p-value, and that p-value was p equals 0.001. And that means there was 1 in 1,000 chance that this result arose by chance.
By chance, yeah.
So it's only 1 in 1,000 chance that this was a fluke. So, and that's just taking the 30 grams a day. So I thought that was quite significant. Now, in terms of diastolic blood pressure, it started off at 86.2. And the diastolic blood pressure went down 5.6 millimeters of mercury to an average of 80.6, which is basically pretty well normal. So it went down from 86.2 to 80, a reduction of 5.6 millimeters of mercury. And when we look at what we call mean arterial blood pressure, the diastolic blood pressure is actually slightly more important. It accounts for more of the average blood pressure. So we've got a good reduction there, over 13 millimeters of mercury reduction in the systolic blood pressure, and nearly 6 millimeters of mercury in the diastolic pressure reduction. I mean, I would have thought that is consistent with the sort of reduction you might get over 12 weeks giving our traditional pharmaceutical hypotensive drugs. Would you think?
Yeah, I mean, that is an absolutely astonishing result. It's
Really
more
is.
than I would have guessed. I mean, I've heard about the benefits of flax seeds, but yeah, it's in line with many pharmaceutical products, and it's entirely natural. And it sounds like they did the study very well. They had different groups. They had a placebo arm, and they made sure that every group was more or less equal in terms of underlying risk and other factors.
Yeah.
And to clarify, John, they didn't change anything else in that group. They told them to keep living their life.
They carried on with their usual diet. They carried on with their usual amount of exercise. But what they actually did was they actually measured all these things in the participants, and they did statistical analysis to find out if there was people doing significantly more exercise in one group or significantly less exercise in another group, or eating better in another group or eating worse in another group. And they found out that it balanced out. So it does seem to be a pretty fair sample that they had. Now, the group, this is also surprising, the group that only had 10 grams of flaxseed, they also had some reduction, about 9.86 reduction in their systolic blood pressure. And they actually had quite a good reduction in their diastolic blood pressure as well. It was actually slightly more than in the 30 gram group,
Really?
but it was actually 6.69. But it's hard to say that is significant, but it's an interesting finding. Of course, what we should do is maybe make some suggestions to Mr. Kennedy that he does a similar study with, I don't know, a few 100,000 people on them, would have some nice definitive results. Because the interesting thing about this study is, when you first put, as a doctor, when you first put someone on calcium channel blockers or angiotensin converting enzyme inhibitors or these other hypotensive medicines we have, do you get people complaining of side effects sometimes, Suneel?
Oh, an absolute ton, yes. I would say probably over half of people will complain of some sort of side effect, whether it's mild or severe. I mean, you mentioned calcium channel blockers there. One of the main side effects would be swelling around the ankles. I've seen some people actually go into more serious cardiac adverse events or collapse because their blood pressure drops down too low. You always have to be very careful, start off at a low dose. The ACE inhibitors have their own risks associated, although I'd say less than calcium channel blockers. To emphasize, this is a sort of study that makes pharmaceutical companies shake in their boots. They absolutely don't like studies like this, and it's sad that our whole philosophy in the Western world is to think first, well, there's a problem, the solution has to be a pill, where we can see here a very well-designed study of something so simple. And I would hazard a guess, if you actually put it to most people, I think most people would rather do this than take a pill.
Absolutely. I mean, a common side effect when you start taking hypotensive medications is it brings your blood pressure down too much.
Exactly.
So I'm sure we've all been in a hot bath or even just lying down and you jump all of a sudden, you go, ooh. You feel a bit weird until your blood. But of course, if you're on a new blood pressure medication, especially if you've taken a bit more than your body wants, then that feeling doesn't go away and the person has to lie down or can even faint. We call this orthostatic hypertension or postural hypotension, where the blood pressure goes too low. And I've certainly looked after patients who've started on these medications, which of course are sometimes necessary, but they can feel absolutely awful for half an hour while they're waiting for the blood pressure. Like lying down with the feet up, feeling absolutely terrible. You know that horrible feeling that you get when you're about to faint, and it's a horrible feeling. And for that to be hanging around for half an hour because someone's taken slightly too much is really quite horrible. Well, these patients with the Flaxseeds didn't get that.
Oh, I'm sure.
There was no reports of
if Flaxseed
orthostatic
knocked pressure down by so much that people got symptoms.
The blood pressure was going down, but they weren't getting the postural hypotensive effects, which is brilliant.
Not the over effects, which are classic with pharmaceutical products. John,
exactly.
I'm assuming the paper does go into a little bit possible physiological mechanisms.
It does. I'm going to come on to that, but we'll just note that there was some reduction in BMI, body mass index, which is interesting, and there was some reduction in total cholesterol, which we could argue about whether that's that's good or bad, but there was some reduction in those. So it did seem to be having these effects as well. So the mechanisms are very interesting. I think we've ruled out placebo effect here because it was placebo controlled. So flax seeds are rich in good fats. So they have antioxidant properties. So it has omega-3s with antioxidant properties. And it also contains fibre, particularly soluble fibre. Soluble fibre is the type of fibre found in oats and fruit and vegetables, and it does, when it's in it can delay gastric emptying. It can make people feel full for longer, so they might be eating less. Because the water soluble fibre is in the gut, it attracts water, it makes the stool quality better, it can prevent constipation, and also cholesterol that's excreted from the gallbladder can bind into the water soluble fibre. And that will be actually excreted in with the stools, in the feces. So sometimes when patients change their diet, they'll come to me and say, John, I'm a bit concerned. This is a bit indelicate, but it's quite important to talk about. They'll say, John, my stools are floating. They never used to float. And I'll say, well, that's excellent, because it means you're taking water-soluble fibre. You're probably absorbing some waste fats into that water-soluble fibre. They're passing out with the stools. And, of course, fat is lighter than water, so you can get light floating stools, which is is good. So that might be part of the mechanism. But there's also perhaps alkaloids in flax seeds that are important. So the omega-3 fats is probably the anti-inflammatory part. That's important. But there's also alkaloids. Now, alkaloids are chemicals that are found in various plants. They might be there to protect the plant against caterpillars or insects or attract bees or all the other things. And there's one particularly called lignan. Now, this is Lagnan, lignan. It's not lignin that's in wood, it's lignan. And that's a low molecular weight polyphenol. And it is known to be a powerful antioxidant. So we have anti-inflammatory effects and we have antioxidant effects. And the researchers also say that this lignan, now the type of lignan is called SDG, and I haven't learned what it stands for. It's a big long chemical name, but it's SDG. And apparently in flax seeds, there's 100 times more of this SDG lignan than in other foods. It is particularly rich in this particular type of lignan, this particular type of polyphenol. And they speculate that that may be working in a similar way to these ACE inhibitors that we've just been talking about, these angiotensin converting enzyme inhibitors. Because, as you all know, but people have probably heard as well, the kidney releases renin, that's acted on by angiotensin converting enzymes to convert it into substances which physiologically raise blood pressure. So it may be acting in a similar way to ACE inhibitors, but apparently without the side effects. So we've got a range of possible mechanisms there. Of course, we don't know for sure, but this lignan also improves plasma lipid profile, plasma trans fatty acids concentrations, which are reduced, which of course we don't want. And it also perhaps reduces over time the formation of atheroma, the atherosclerosis in the blood vessels. And although this would take time, but the stiffer the blood vessels, of course, the less they're able to move with the pulse as the blood goes through it, and that can lead to blood pressure increases as well, the stiffer blood vessels. So it may well be that this polyphenol is having a relaxing effect on the blood vessels, combined with a significant anti-inflammatory effect, because we know that inflammation is involved in all sorts of disease. Is that your understanding, that excess inflammation is a bit of a problem these days, Suneel?
Oh, yes. Yeah. And that's a really good explanation there that they gave, and your breakdown of it. And I'd like to come back to this this observation that cholesterol levels also came down, because to me this makes sense from an anti-inflammatory perspective, because what we know is that a very large number of cases, in fact the vast majority of high blood pressure, hypertension cases nowadays, is caused by underlying insulin resistance, also known as hyperinsulinemia. People have too much insulin in their body. This is natural insulin, nothing to do with the diabetics who receive insulin, but because we have so many unnatural insulin spikes and we live very poor lifestyles, too many carbs, too many sugars, too many processed foods, our insulin levels are too high. And insulin resistance is intrinsically associated with high blood pressure, high cholesterol, and pre-diabetes, type 2 diabetes. In fact, I would argue that they are the same disease. They're all within the same circle. So what I'm thinking here is that if flax seeds are working against insulin resistance, because insulin resistance is also pro-inflammatory, there's lots of oxidative stress and mitochondrial dysfunction. If you have a compound which is acting against that, then you will have an effect also on blood sugar levels and blood cholesterol levels. So yes, if flax seeds are doing that, you'll probably get improved markers all around.
So there's a plausible pathophysiological, almost pharmacodynamic mechanism of action there that does actually make sense, mediated through insulin resistance. Insulin resistance is what we don't want. Many of us have insulin levels that are too high for much of the time, and that is putting a strain on the insulin receptors, and we're developing insulin resistance because our insulin is too high for too much of the time.
Yeah, absolutely. The vast majority of people now sadly have it, and a lot of the modern day blood tests don't even pick this up. I've talked about this in my videos. I think fasting insulin should be checked much more in people. I don't know why we don't do that. But yeah, flax seeds are obviously having some effect on this whole pathophysiological process.
It's interesting. So flax seeds is one of the richest plant sources of omega-3. The fatty acid particularly is alpha linoleic acid, ALA, alpha linoleic acid, and that oil forms 41% of the weight of the flaxseed. So, and then add a bit of your polyphenols as well, your lignin polyphenols, and you've got a plausible mechanism. But I have never come across anyone who's allergic to flaxseed. There may be one or two people out there. So this is a food. It's an incredibly safe thing to do. And I, for one, have changed my diet to include more flax seeds. I wouldn't say I remember every day, but maybe 4 or 5 days a week I remember. And I had a fair dollop to my porridge or my yogurt or whatever I'm eating that day, and it's absolutely fine. And with it being fatty as well, of course, we know that when you do eat carbohydrates in combination with fats, the fat will actually lower the rate at which the carbohydrate is absorbed, which will have the effect. So if I eat this with my porridge, that will have the effect of lowering the glycemic index of my porridge. The carbohydrate in that will be absorbed more slowly, hopefully keep me full for longer. I won't get these spikes and dips in blood sugar, and it's just a better, more natural way to eat all round. So that's the tip for today. Flax seeds. Check it out at your local supermarket, and you now have the education to make an informed choice.
Yeah, a very easy thing to do there. Very easy thing. It would be compatible, I'm sure, with many foods, and a wonderful tip. I have typically had flax seeds in smoothies. Actually, yeah. I've added them to other foods as well. I think I'm probably going to go and buy flax seeds now myself after hearing this, because 2 points that I'd really like to stress on our viewers, which is about what this series is about. These are all natural, easy things that are obtainable. And one thing I'd like you to really remember is that will flax seeds or anything else we're going to talk about magically change your whole health? No, they won't do that. But it's all about compounding. We talk a lot about compounding in finance, but actually health, I would argue, has even more of an effect. The more little things you can do, even if you do it 3 or 4 times a week, and then you learn to do something else which is good and something else natural, and it all adds up over time. And imagine this particular study where people didn't change anything else and they still had that effect. Mm-hmm. Imagine if you actually change a few other things as well and say, okay, I'm going to do this, but I'm also going to walk 10,000 steps a day, or I'm going to try lifting some dumbbells. All of these things add up rapidly. And I know I speak for myself, and I'm pretty sure that John feels the same way. We really want you to be well. We want you not to be a recurrent customer of the medical industrial complex, and any natural way to do that should be utilized.
A good doctor should have 2 things on his desk, Suneel.
What are they?
His feet. Because all his patients are well and don't need to come and see him or her.
Oh, yeah. That's true.
Yeah. So let's have more doctors with more feet on desks. That would be great. Suneel, it's your turn next time. I'm curious. I'm not going to probe. It's entirely up to you. We'll see what you come up with, and we'll do something similar the other way around. But for today, thank you for really bringing that to life. Actually, that was actually really helpful with those extra bits from your medical background that really have helped my understanding as we went through that. So for now, thank you, and look out for the next one in this series. Yep,
and consider getting some flax seeds.
Absolutely. So Suneel's turn next. I'm looking forward to it. We'll talk soon.
Yeah, bye-bye.